Alright, here's the quick and dirty on when and why to resuscitate an avalanche victim. This seems to be an area of significant concern where people often get pretty confused. In fact, it's pretty straightforward, and what I'm going to try and do is simplify things as much as possible. First of all, thanks to Luann Freer for some of these slides and photos of pictures more exciting than places that I normally travel. What this is not going to be is any sort of talk on avalanche rescue. Those of you who are watching this know that part better than I do, and we're not going to be covering that. What this is going to be is a talk of why people die during avalanches and why knowing the different stages of what they die from should change what you do. So if you're caught in an avalanche, there's three phases of what is going to kill you. The first is the first 15 minutes. If you died during the first 15 minutes, it's probably due to trauma sustained during the slide. Either things you were drug over, things you were dragged through, or other forces that were applied during the slide itself. If you survive the first 15 minutes, your next hurdle is being able to breathe, and deaths during the first half hour. The next phase is asphyxiation or suffocation. If you have an air pocket, if you have a way to breathe, a device such as an Avalance or an air pocket, your next hurdle, if you are not dug out in time, is deaths due to hypothermia, which tend to be after the 90-minute mark. Hypothermia tends to set in fairly slow for avalanche victims. For one, snow is a pretty good insulator. Think about what you do if you're stranded in the backcountry during the nighttime in the winter. You dig a snow cave because of the insulation properties. Also, those folks who are caught in avalanches usually have pretty good winter gear on at the time of the burial, so they're often well insulated that way as well. These stages break out pretty well when you look at the empiric data. So this is data taken from 422 avalanche victims in Europe and their survival. Down here is time, and up here is the probability of survival. So start with 100% survival, and in the first 15 minutes there's a pretty steep drop off, and those are the deaths due to trauma. There's a little bit of a plateau here, those that have survived the first trauma, but then people start dying from suffocation. There's a very steep drop here due to suffocation and asphyxiation. If you survive to the 35-minute mark, that point there's a real good plateau here. If you survive to that point, it's pretty good that you're going to survive till about 90 minutes. That means you survived the first trauma, you survived the not being able to breathe, and you're sitting pretty until about 90 minutes when hypothermia starts to set in, and then you start to die from hypothermia here. So therefore, this is the time period, 35 minutes, that most people break avalanche resuscitation at. That's the break point. People who are extricated before that are ones that you're worried about the trauma or the asphyxiation. If you dig them out after that, you're worried both about the trauma or the asphyxiation, but also now you start to take into effect hypothermia. So that changes why we resuscitate them the way we do and how we resuscitate them as well. So if you get people out within 35 minutes, it's a rapid extrication. What you want to do is prevent asphyxiation. If you're getting them out after 35 minutes, they've already survived the period of asphyxiation, or they've already succumbed to it. So there's not the same urgency to dig them out. Now you can take a little bit more time. Hypothermia may have set in. People who are cold, a heart that is cold is very sensitive to movement and being jarred, and can go into VFib, VTAC, or other arrhythmias. Therefore, after 35 minutes, the recommendations are for a more gentle extrication of the patient. The other key at this point is to the check for an air pocket. You want to know when you get that patient out, if they don't have a pulse, or if they're not breathing and they're not responding, and they're pulseless, did they have an air pocket? Is it likely that they survived that first 35 minutes, or was there no sign of an air pocket and it's likely they died long before you got them out? So, under 35 minutes. If you get to the patients in under 35 minutes, it is very unlikely that hypothermia plays any role. If they didn't have an air pocket, they will die of asphyxiation if they survive the first trauma. An air pocket is defined as any space in front of the nose or mouth, no matter how small it is, or something like a device meant for avalanche burial. So therefore, what are you going to do under 35 minutes? If you're going to get them out, you're going to treat them the same as we do anybody in respiratory or cardiac arrest that's due to trauma or asphyxiation. Therefore, you treat the same as any other trauma or respiratory arrest. I think we get somewhat overwhelmed by the thought of the hypothermia and the thought that somebody who's buried in snow is going to be a different scenario. But anybody who's dug out this early, you treat with your standard protocols the same as you would any arrest that you came on from a car wreck, from somebody who basically any other trauma or any other respiratory arrest. However, after 35 minutes is when things start to get different. Now hypothermia comes into play, a la Han Solo. Now we have to start taking a little bit different approach. These patients need to be handled more gently. We start to have longer checks for signs of life. The recommendation is for a pulse check in somebody who's like hypothermic to go up to 60 seconds. It can be real hard to find a pulse and signs of breathing in somebody who's hypothermic, and therefore we give them a longer chance. There's also been reports of amazing resuscitations of people who have been down for hours or who have been resuscitated over hours of CPR, and in the setting of hypothermia. The thought is that the hypothermia protects their body, can protect their brain, and can help provide for successful resuscitation even after these longer resuscitations. It's important to know that that's the exception. That's still not the rule, but it becomes more possible with hypothermia, and that's where our guidelines start changing. Again, using the 35-minute mark as the break point. So avalanche rescue, again, after 35 minutes, gentle extrication to prevent VFib or other cardiac arrhythmias. If they still have a chance of living after 35 minutes, they will have had an air pocket or some sort of device. And at this point, they are risk for hypothermia. So here's an algorithm. This is for a ALS provider, but we'll go through the BLS ones as well. For any patient after 35 minutes that you extricate with no signs of life, you need to handle them gently. You need to check for an air pocket as you extricate them, because you'll see that becomes key. We give them 30-second pulse checks, and you're looking for signs of life. Even if you can't find a pulse, if they're moving around or it looks like they're breathing, you consider them alive. So initial assessment, do your ABCs. If you have access to a monitor and you put them on the monitor and you see any sort of rhythm other than asystole, VFib, VTAC, PEA, anything, they get a full resuscitation. And you continue it as long as it is safe and feasible to continue that resuscitation. If they're in asystole, now we need to know, was there that air pocket? Did they have an open airway during the burial? If there was an intact airway or air pocket, it's still worth continuing the resuscitation. Again, hypothermia may be playing a role at this point, and it's worth giving them more of a try at resuscitation. If they didn't have an airway, if they didn't have an air pocket, it's time to cease efforts. It's likely that they didn't survive that first half hour, and now it's too late. Same thing for BLS with an AED. You can use an AED for that same division point in the middle. If it advises a shock, there's some sort of rhythm, and you need to continue the resuscitation. If there's no shock advised, then you use the airway as your defining point. If there was no airway, it's likely that they succumbed to respiratory arrest due to suffocation and not with hypothermia playing a role. If there was an airway and an air pocket, it's worth continuing. If you don't have an AED, you just use the airway as your defining point. I think this is the more likely situation for most backcountry rescues and most avalanche rescues. So after 35 minutes, And again, 35 minutes being a rough guideline. No one's going to have an exact stopwatch out there. You use the airway to help decide whether you continue or whether you cease. Um, Other questions about termination of resuscitation. It's always a big question. When do we stop? If you start the resuscitation, you stop at any point if the situation becomes dangerous to the rescuers. It's not worth having to rescue or resuscitate more than one patient. If you have any signs of trauma incompatible with life, you do not proceed with any further resuscitation. If you attempt resuscitation and the chest is so frozen that you cannot do compressions, that's the time to stop. Under 35 minutes, you follow whatever your local usual protocols are for termination of resuscitation, and some of this may depend on the location and situation. A BLS provider in a search and rescue role who is 5 miles out into the backcountry, there's not going to be any feasible way to continue CPR for that extrication and for the duration of that extrication of the patient. The usual in that realm is to do 30 minutes of attempted CPR and resuscitation before considering termination. So, just in summary, CPR and ACLS, per your usual protocols, for any burials less than 35 minutes. Again, at that point, hypothermia isn't playing a role, so just take it out of the question and do the same thing you would do for any usual trauma patient or respiratory arrest. Same for a choking patient. Um, After 35 minutes, the dividing point becomes if they had an air pocket or an airway. If there's no air pocket or airway, there's no point in continuing resuscitation. If there was one, then it's worth continuing. All right, that's it. Please let me know any questions, drop me an email, or send me any questions, and I'll do the best to answer them. Thanks, guys.